Good afternoon. My name is Chris Heimbaugh. I have the honor of being the CEO of Addiction Treatment Services here in Traverse City. As many of you know, we are a local nonprofit treatment center with the full continuum of care. And I just wanted to come at you today with three quick asks and to just touch base with our community. First, I want you to know that our staff, our amazing, brave staff, have been working through an epidemic for years, the addiction epidemic that we're struggling with as a nation that caused the death of 60,000 folks last year in our country alone. And we've done that with bravery and with courage and creativity and resilience. And now we find ourselves as an essential life-saving service at a crossroads of two epidemics, or an epidemic and a pandemic. And we again are on the front lines with grit and resilience and creativity and bravery. Our staff are here for this community in a way that I want you to know about, in a way that I want you to be proud of, and in a way that is affecting a lot of lives, is saving a lot of lives in multiple ways. And so my first ask really has to do with that. We have 100 beds in our community, in our organization right now, between our detox facility, our men's and our women's residential facility, and our recovery homes. Those are our friends, our neighbors, our coworkers, our loved ones. And we are every day showing up to care for those folks. And so as this pandemic continues, and it looks like it will for another couple of weeks, as the weather gets nicer and we start getting a little more antsy, I ask you, I beg you, to continue to do your part, whatever that means. But if it means to stay home and stay safe, I ask you to do that for the sake of our staff, for the sake of our clients. Those struggling with addiction right now that are in our residential services are in a safe place. We're doing everything we can to ensure that they are. Our staff are doing everything that they can to ensure that their travel between work and home is safe, that they're keeping themselves, our clients, and their own families that they're going home to safe. So we ask you to do your part. It's really that simple. The way through this, we know the data is starting to show signs that this is working. The social distancing and other measures are starting to show signs of hope. So if we could just hang on to that, our agency, our staff, I would appreciate that as we continue to serve our folks. We're also serving folks in an outpatient capacity. We've moved our entire operation to online services and face-to-face, so it looks a little bit like this, two people talking to each other, having a therapy session, and the feedback's been fantastic. And so, again, we're doing what we can to keep our community safe. Which brings me to my second point, which is both a thank you and an ask. And first, thank you for the folks that have so graciously donated masks and other supplies and hand sanitizer to our organization that, as you know and as you hear, hard to get our hands on. And so we're at a point that we're trying to get that all staff and clients can be masked. All clients that are discharged can leave our community, our centers with the mask, so they can keep the community safe. So if you have the ability to make more masks, we'll welcome them. If we for some reason have an abundance, we have community partners like Safe Harbor and Street Outreach that will work with to make sure that we're good stewards of those resources as well. And so if you'd like information on that, we're going to post that in the comment section here, some contact information. And that brings me to my kind of last ask, and it's potentially a little more personal to you or to a loved one. We want to make sure that you know that we are here for you. If you are struggling, if a loved one is struggling, if you know somebody that is, these are challenging times right now for all of us, especially somebody struggling with a mental health or substance use issue. Please know that we're here. Again, there'll be information in the contact so you can reach out. If you need somebody to talk to, we can be here. If you need residential services or detox, we can be here for you. Of course, we have safety measures in place, and we're doing a lot to again to our practice has changed, but we're still here for you. We're fully operational, and we want to make sure that our community can provide you what you need. Even if it's not with our organization, we're every day we're helping folks find other resources in the community. So please reach out. Don't be alone through this. Make sure that you know that you are cared for, and that caring for yourself is an important part of how we care for our community. Nick Tot Han had said once something to the effect that hope is really important because it makes the present moment a little less difficult to bear. Because if we believe that tomorrow is a little bit better, then it makes the hardships of today more tolerable. And so that's at the end of the day, that's what I'm asking. Is if we know that you support us, if we know that you have our backs, if we know that the community understands why we're here and what we're doing, and that if you have an opportunity to reach out to one of our staff, if you have an opportunity to post something on our page in support, we could use it. We'd appreciate it. If you'd like to engage in a lot of activities, our community center, The Porch, has moved a lot of activities online. And so make sure you connect with that page as well. Again, we'll put that information in the comment section. But we hope that you stay safe, that you stay well, and that we know that we'll be through this shortly. We'll be together again, hopefully in different and more beautiful ways. But that those days are coming, and we're looking for you to help give us a little hope to make today a little more bearable. Thank you, and we appreciate everything that you all are doing, and hope happens here thanks to you. Be well.